Dear students, welcome back. In the previous session, we have discussed about the introduction to wrist complex as well as the hand complex. Now, in this session, we are going to see the wrist complex structure. The wrist complex structure consists of two compound joints. One is the radiocarpal joint as well as the midcarpal joint. Now we are going to see the radiocarpal joint structure. The radiocarpal joint is formed by the radius and radio-ulnar disc, radius and the radio-ulnar disc, which is a part of triangular fibrocartilage complex proximally, and by the scaphoid, lunate and triquetrum distally. So these are all the structures which forms the radiocarpal joint. So here, this radiocarpal joint, to understand better, this joint is divided into proximal segment, so this one, and the distal segment. Now we will see the proximal segment. The proximal segment of the radiocarpal joint consists of the distal radius as well as this articular disc. Okay. Now, if you see this distal radius has a single continuous biconvex concave curvature. So here you can see this is the biconcave curvature that is long and shallow from side to side. It is seen in the coronal plane. Okay, and it is shorter and sharper in the AP position. So if you see, this one is the antero-posterior position. So this one is shorter and sharper antero-posteriorly in the sagittal plane. This one is the frontal plane. So in the frontal plane, this one, the distal radius is long and shallow. Okay, the proximal joint surface. So the entire proximal joint surface is composed of the lateral radial facet. So this radius is again divided into two facets. One is the lateral radial facet and medial quadrangular facet. So the proximal joint surface is composed of lateral radial facet which articulates with the scaphoid bone, and medial articulating surface which articulates with the lunate, and the triangular fibrocartilage complex which mainly articulates with the triquetrum, although it has some contact with the lunate when the wrist is in neutral position. Okay, the radio-ulnar disc, a component of the triangular fibrocartilaginous complex, also serves as the part of distal radio-ulnar joint. That thing we have already seen in the previous chapter, that is in the elbow complex. And as a whole, the compound proximal radiocarpal joint surface is oblique and angled slightly olarly and ulnarly. So that means because of all these structures of articulating parts forms this proximal radiocarpal joint surface as oblique and angled slightly olarly. Olarly means anterior aspect. It is making a slight angle, and also ulnarly. So how this angulation is formed means based upon the size of this radius, such kind of angulation or obliquity is formed in the proximal radiocarpal joint. So the average inclination of the distal radius is 23 degrees. So if you can see, this is the normal inclination of the radius is 23 degrees in the frontal plane. How it is occurred means because the height of the distal radius, that is the radial length, is 12 millimeters greater on the radial side than the ulnar side. So if you see, this one is the ulnar side of the radius and this one is the radial side of the radius. So when you compare these two things, so it is 12 millimeters greater than the ulnar side. So it is making an angle of 23 degrees in the frontal plane. If you see in the sagittal plane, so that is olarly, the distal radius is also tilted 11 degrees. So here it forms 11 degrees because the posterior, so here you can see the posterior part, the posterior radius is slightly longer than the anterior radius. So this up to here, this one is the anterior and this one is the posterior. So if you can see here, it is having some tilt here and it is making 11 degrees because of slightly longer posterior radius. Okay, so for the obliquity, you can see in the proximal radiocarpal joint structure is due to the size variation or the height variations of the radius. Okay, and the next one is the triangular fibrocartilage complex. So because of its triangular fibrocartilaginous complex consists of radio-ulnar disc and the various fibrous attachments which provide the primary support for the distal radio-ulnar joint. Although the attachments to this triangular fibrocartilage complex may vary. Okay, so here you have to consider the overall triangular fibrocartilaginous complex function is at the wrist. It acts an extension of the distal radius. What the same work it is done in the distal radio-ulnar joint. The same function here it is also exhibited. That thing you have to consider here. So there are some modifications in this triangular fibrocartilaginous complex that we will see separately in the next session. So what is happening there? Okay, next. And the next one is the distal radiocarpal joint surface. So the scaphoid, lunate and the triquetrum compose the proximal row of carpals. This will articulate, the proximal row articulates with the radius and radius, that is mainly the distal radius, and it also articulates with this articular disc. Okay, now these bones are interconnected. So that means the scaphoid, lunate and triquetrum bones are interconnected by two ligaments, like the carpals themselves are covered with proximally. That means here if you can see here, proximally it is attached with two ligaments. So one is the scapholunate ligament that is called as interosseous ligament also. This luno-triquetral interosseous ligaments. So, and also the entire surface is covered by the cartilage, articular cartilage. So, the articular cartilage along with these two ligaments appear to be a single biconvex cartilage covered the joint surface, and it is having some capacity to change their shape to accommodate the demands of the space between the forearm and hand. Okay, this forms the distal radiocarpal joint surface. All the pisiform is also present in the proximal bone, but it is not taking part in the radiocarpal articulation. The main function of the pisiform here is it is an entirely sesamoid bone which helps to increase the momentum of the flexor carpi ulnaris which surrounds this pisiform bone. And the curvature here, the very important thing, the curvature of the distal radiocarpal joint surface is sharper than the proximal articulating surface. Okay, so the distal one is very much sharper than the proximal. This one is the proximal and this one is the distal. The distal curvature is sharper than the proximal joint surface in both the sagittal as well as in the coronal planes, which makes the joint somewhat incongruent. So that incongruence is developed because of the increased sharpness in the distal one than in the proximal one. So because of this incongruence, the articulating surfaces contact is very minimal in between them. That means only 20% of the radiocarpal surfaces is in contact, with maximum of 40% of available surfaces in contact at any one time. That means, so it is having so much of surfaces, but because of this incongruence, these two surfaces will contact only up to 20% and it may increase up to 40%. Beyond that, there is no contact between these two articulating surfaces. Because of this such kind of incongruence and angulation of the proximal radiocarpal surface creates or result in greater range of flexion than extension and in greater ulnar deviation than the radial deviation. So this is the very important point, you have to keep it in mind. Okay, so not only the curvature and inclination of the radiocarpal surfaces affect the function, but the length of the ulna is in relation to the radius also being a factor which affect the function. Okay, so what happens here means, so there is another factor called as ulnar variance. So this ulnar variance is another factor which affects the function of the radiocarpal joint structure. What is that means? So the ulnar variation is defined as measurement of the length of the ulna in relation to the radius is called as ulnar variance. This is of two types. One is ulnar negative variance and next one is the ulnar positive variance. This one is the positive variance and this one is the negative variance here. Here, how this is defined as the ulnar negative variance is described as it is a short ulna. This one is a short ulna in relation to the distal radius. In relation to the distal radius. So here this is the point where it is present distal to the radius. Whereas the ulnar positive variance means the distal ulna is long in relation to the radius. So if you can see here, it is long in relation to the radius. Here it is shorter in relation to the radius. So this ulnar positive variance has been associated with changes in the triangular fibrocartilage. So here this is the place of triangular fibrocartilage complex thickness. So what happens in the case of positive variance means when an axial load is applied to the wrist, the scaphoid and the lunate receive approximately 80% of load, whereas the triangular fibrocartilaginous complex receives only 20%. So if you take only at the distal radius, this scaphoid, if you take it is only for the radius, the scaphoid only takes the load of 60%, whereas the lunate will take 40% of load. Okay, so such kind of load can be taken in the normal conditions. In the case of positive variance, what will happen? This the space between this ulna as well as the triquetrum is going to decrease. The structure which is present in between them, that is the fibrocartilaginous complex, is going to impinge during the movements of the wrist. Okay, so that means in the positive ulnar variance there is an thinner fibrocartilaginous thickness can be observed, whereas in the negative variance the space in between them is increased and there is a chance of greater thickness of fibrocartilaginous structure can be seen. Okay, so normally this kind of positive ulnar variance can be seen in distal end of the fracture of the radius, which was healed in shortened position. Okay, so whereas in the negative variance what will happen? So because of such kind of dearrangement, the amount of load which is going to taken up by all these bony structures becomes abnormal. So such kind can be seen in avascular necrosis of the lunate bone. So overall what happens means in the case of ulnar variance, there is an impingement of the structures which is present between this ulna and the triquetrum, and also there is an abnormal force distribution across the radiocarpal joint can be seen. So these are the factors which affect the function of the radiocarpal joint. Okay, these are the two things you have to consider. One is the angulation of the radius and also the ulnar variance. Both you have to consider in the case of understanding of function of the radiocarpal joint. Okay, these are all about the structure of radiocarpal joint. Finally, we can explain this joint as this wrist joint or the radiocarpal joint is a synovial joint of the ellipsoid variety formed between the distal aspect of radius and the articular disc proximally and the proximal row of the carpal bones on the distal aspect. and it is having capsular attachments and ligaments which are having a very important role in the function. But this midcarpal joints is also associated with the same kind of ligaments and the capsular attachments. So after studying the midcarpal joint, we can study these ligaments and capsule together. Okay, in the next session we are going to see the midcarpal joint. Thank you.